Uber wants to make it easier for people to get to and from doctor's appointments. Called Uber Health, the service lets doctors hail a ride for patients, even if they don't have a smartphone. Depending on the patient's needs, an Uber can be called immediately, within a few hours, or with 30 days notice. The car can either be sent to the patient's house, or it can pick patients up at a medical facility and take them home. Uber has partnered with more than 100 healthcare organizations in the U.S. to launch the service, including hospitals, clinics, rehab centers, senior care facilities, home care centers, and physical therapy centers. The ride-hailing firm has been testing Uber Health with a beta group of hospitals and doctors since July, but the service is officially launching starting on Thursday. Uber Health can be accessed either as an online dashboard or as an application programming interface (API) that software developers can integrate into their own healthcare systems. The company stressed that Uber Health complies with HIPAA patient privacy laws. Passengers don't need a smartphone or the Uber app in order to use the service because Uber Health sends riders notifications about their car via text message. The dashboard also comes with a printable sheet allowing the doctor to circle the incoming Uber's car color and write down the license plate number. Uber wants to expand the service so that passengers with landlines can get trip details that way, The Verge noted. This would be especially helpful for senior citizens who primarily use a landline to make and receive phone calls. Additionally, the passenger isn't billed for the ride because the providers will cover the cost. Ultimately, the goal with Uber Health is to hopefully reduce the number of no-show appointments, something that's exacerbated by people who can't get a ride to the doctor, the firm says. Uber said 3.6 million people miss or delay appointments due to a lack of reliable transportation. This ends up costing the healthcare system about $150 billion each year. While transportation barriers are common across the general population, these barriers are greatest for vulnerable populations, including patients with the highest burden of chronic disease, Uber explained in a blog post. Patients also noted that Uber Health made getting to and from their appointments much easier. "My health crisis was a lot to manage," a patient from San Diego said, according to Uber. "Knowing I had reliable and comfortable transportation to and from my oncology appointments was one less burden on a very long list," they added. While Uber Health seems like a positive service in several aspects, privacy experts were quick to point out that Uber's past data breaches might present some concerns in the near term. Last November, Uber admitted that data from as many as 57 million customers had been compromised as part of a system-wide data breach. Uber employees have also been accused of abusing customer data. However, Jay Holy, head of partnerships at Uber Health, told The Atlantic that this shouldn't be a problem. Uber Health's data is cordoned off from Uber's other data, and only a select number of employees are given access to it, he said. Aside from customer privacy, experts caution that Ubers should not be treated like ambulances. It's been previously reported that some people often use Uber as a replacement for calling an ambulance, perhaps because they're cheaper than emergency transport. With Uber Health, there may be a gray area concerning liability if, for example, a patient faints in the backseat of an Uber. The burden on the platform and the healthcare provider to ensure against something going wrong with the patient is a lot higher if the patient is calling the car themselves or runs under Aragon, a professor at New York University, told The Atlantic. The fact that they are only launching this service now, and not in the past, is because it's likely taken a while to work out the details, he added. In most cases, it'll be up to the doctor's discretion to decide whether a patient is well enough to take an Uber, or if they should call an ambulance instead. Additionally, if a patient experiences some kind of medical emergency in an Uber, the company says the driver is encouraged to call 911.